in my office, interacts with both CPOs in this fashion. OCC, the Office of Contract Compliance, is responsible for a couple of functions. We certify minority-owned and women-owned, veteran or persons with disability-owned businesses to become certified with Cook County government to perform on contracts at Cook County government and at Cook County Health. That is one function of our office. The other function of our office is the compliance team. They will interact with the CPOs on both sides, pre-award, post-award, and during award. They do that by establishing goals or looking at contracts before solicitation to determine if we're able to obtain a goal on a contract. At award, they review. There's a component that they review, which is specifically the utilization plans, where if there is a goal established on a contract, they will review the utilization plan to make sure that the subcontractor that the prime has selected has the capacity and the experience to perform on that contract. And then on the back end, after a contract is awarded, then our team is still involved to make sure that whatever terms and conditions that were signed by the prime contractor and the subcontractor are met. If there's a goal established, we continue to follow that until the contract ends. So our team really works with both departments, establishing goals, monitoring the goals, and just being able to follow the contracts and be also being an advocate should there have a need arise between the subcontractor and the prime. How was that? Was that good enough? Did I miss anything there, guys?
No, you were good. That was a perfect introduction. Perfect introduction. Rafi, it's on you now.
Thank you, Dr. Butler, and good morning, everyone. Very briefly, I am the Chief Procurement Officer of Cook County, and we are responsible for procuring all the goods, services, and construction necessary for the daily operation of Cook County. That means that we procure for all the bureaus under the president, and we also procure for all of the elected officials of Cook County. Such as the sheriff, the state's attorney's office, the office of the chief judges, the treasurer, etc. As important as who we purchase for is who we do not purchase for, and we do not purchase for our county sister agencies. We're joined here by Charles Jones, the head of procurement for Cook County Health and Hospital System. We do not procure for the health and hospital system, with the exception of their construction procurements. We don't procure for the Forest Preserve. We don't procure for the Cook County Housing Authority, etc. We also do not procure for the city of Chicago and the city's sister agencies. We also do not procure for the state of Illinois, and we don't procure for the other villages and cities in Cook County. The reason why we don't procure for all those entities is that they have their own procurement codes and their own procurement departments. So that's an overview of a very quick overview of the Office of the Chief Procurement Officer. Thank you.
Thank you, Rafi. So, Mr. Jones, he hates when I call him Mr. Jones. I'm sorry, Charles. Charles, feel free to go ahead and introduce yourself.
Yeah, good morning. Thank you, Nicole. Charles Jones, Chief Procurement Officer for Cook County Health. Thank you very much, Dr. Butler. Thank you very much, Dr. Butler, for inviting me today to this event. I do all the procurement for Cook County Health and Hospital Systems, actually, but we do business as Cook County Health. And with that being said, all of the procurement that's necessary on behalf of the health, we work in conjunction with Nicole's department, the Office of Contract Compliance, for any procurements that we do over $25,000 for MBE-WBE participations. And there's times we have opportunities to collaborate with Rafi's shop for for items that his department does on behalf of the entire county that ties us in, or any comparable government procurements here or there, and or any joint procurements. But in a nutshell, I run the Office of Supply Chain Management here as the Chief Procurement Officer, and within that, I'm responsible for contract management, vendor management, logistics, materials management, value analysis for any collaboration that we're doing with certain vendors to bring in new product for the surgeons and clinical within the health system, and then overall procurement, again, of the entire health system. Thank you.
Great, thank you so much. So let's go ahead and get this conversation going. So this first question is for Rafi. And really, we're going to just have a conversation. I kind of have these questions guiding us in terms of what we're going to talk about, but it's more or less a conversation that we'll kind of just navigate to and from. But Rafi, I kind of want to start with you. So the relationship between Cook County and CCH, I know you kind of alluded to it when you did your introduction. I know you mentioned that the procurements are done separately with the exception of the construction procurement. So Cook County does procure construction procurements for the hospital systems. But is there any other type of a relationship that, because I know, so let me just preface by saying this. One of the biggest questions or misconceptions that people have, especially when I talk to them, is they didn't know that there was two separate entities, two separate networks, which kind of allowed me to be able to move in this space to have this type of platform put in place to kind of clear that over. Can you, Rafi, talk a little bit about what the relationship is with CCH outside of what we know Charles does with Nicole and the Office of Contract Compliance? Is there any other type of extension or the relationship that you have with CCH to any degree?
Sure, and thank you for the question, Dr. Butler. Yeah, our relationship is, I can sum it up in one word: collaborative. We work together throughout the course of the year. Charles and his team will reach out to us with questions, and similarly, we might reach out to Charles and his team with questions. Beyond us doing the construction procurement, one of our other procurement methods is what's commonly known as piggybacking. And that's when a government agency looks to use the contract of another government entity. And so time to time, Charles and his team might reach out to us and say, we're interested in procuring, a certain item or certain services. Do you have a contract for it? Or they might look at our contract database and see that we do have a contract that fits their need, and then they'll specify the specific contract. Similarly with us, we're always looking to make our operations more efficient, more streamlined. And so if Charles and his team have a contract that was competitively let, we might reach out to them and say, hey, can we use this can we participate in this contract? The other way that we collaborate, at the OCPO's my homepage, among the links that we have are current contract opportunities, and that's the page where we make available in real time all of the solicitations that are out and open and advertised. And if you were to go to that page, you would see we have links at our contract opportunity page to the contract opportunity pages for some of our county sister agencies, notably the Forest Preserve, but also the health and hospital system. So from our contract opportunity page, with one click, you can go straight to the contract opportunities page that Charles makes available for Cook County Health and Hospital open solicitations. So we're trying to make it easy for people to find the information they need so they can make the strategic decisions they need to make. Another way we collaborate, as most people know, Cook County procurement, we have a buying plan. We released that at the beginning of the year. And in that buying plan, the highlight is always the table of the upcoming or anticipated purchases for the upcoming year. And we include in that buying plan the table of upcoming purchases, not just for the OCPO, my team, but also for the forest preserves and also for the hospital. Again, it's through that collaboration and making the information available that we're trying to help people get the information they need so they can make those strategic decisions they need to make. And then it's events like today where we're together here at an outreach event and we're participating together and answering questions. So our again, the word is collaboration, and it continues through outreach events like today.
Great, thank you, Rafi. So I'm going to give just a quick follow-up question. This is kind of off a little bit the grid, but when Charles made his introduction, it kind of actually made me aware of something with our Cook County government. So Charles mentioned that they procure for contracts over $25,000. Is that correct, Charles?
Well, we procure for all purchases, but I'm saying based on definition of policy and all, 25,000 and up is when MWBE participation becomes a role, and then we collaborate with Ms. Mandeville's office.
Okay, so the reason why I asked that question, this is for you and Rafi. How do you all procure for those smaller size contracts? So the contracts that fall under 25,000, what's a process, just generally speaking? Because I know that question comes up also. So either one of you, how would you go about procuring or seeking out vendors for those smaller size contracts? And what would be a process for those vendors to actually be able to follow if they were interested in those? Or are those contracts even, how are they made known?
At the OCPO, the Office of the Chief Procurement Officer, we get by our procurement code, we get involved at $15,000. So any purchase under $15,000, departments are free to go to whomever they want and procure the goods or services they need. Anything above $15,000 here at the OCPO, that's when we get involved. We being the OCPO. As Charles just said, at $25,000, that's when Office of Contract Compliance then gets involved to review solicitations and set goals. And then above $15,000, then we look at doing a bid or an RFP or an RFQ. In terms of a in terms of a small business program or a small procurement program, I should say, we currently don't have one, but that's something we are looking at doing going forward as a strategic initiative, is to see what can be done to implement a small procurement program. But at this time, we do not have
one. And for us, our policy is still a little bit dated because we're still at the $5,000 mark for small procurements where we may do open market purchase. We issued usually departments can come to us with at least 3 quotations from vendors for us to choose or select from for that particular service. We are going to take it to the board somewhere in the next couple of months to have our policy updated. And with that updated, we'll be in line with the county at the 15,000 for that.
Okay, thank you both for the clarification on that. I know that that's something that is often a question from our attendees and small business community and vendors. So I did want to kind of do a sidebar on that. So Nicole, can you talk a little bit about how you support, how the OCC in general supports Charles and the Cook County Health Network? So I know you talked a little bit about it when you did your introduction, but can you maybe, because there may be some questions that come into that and to play with that, can you just talk a little bit more about how the OCC supports Cook County Health and how that relationship or collaboration actually goes in play?
Sure. So just like working with Rafi, we So first of all, the hospital is not a certifying entity. So contract compliance is Cook County government's certifying entity. And we certify the MWBE program here at Cook County government. And so obviously the hospital also has a need on their contracts, as Charles had mentioned earlier, anything $25,000 and above. We look at to see if there can be a goal established on those types of solicitations. So first of all, the first thing is we oversee the MWBE program. And then once we have certified vendors in the pool, we're able to, based on the scopes of work that are in solicitations, we will work with the hospital to determine if we can establish a goal and get participation from minority-owned or women-owned businesses on a particular contract. We do have dedicated staff that that supports the hospital directly, because there's a little bit, not a little bit, there's a lot of specialization there. That person needs to be able to understand what the hospital is procuring. Because this, again, when you think about the government side, there's goods and services there, there's construction, and there may be professional services. But when you think about the hospital, you have those things, but then you also have the clinical needs of the hospital. And so it really is beneficial that we have someone who understands what the needs of the hospital is. And they also help us in our relationship with, I'm going to mess it up, with Vizient, who is the GPO provider, because not every type of thing that the hospital has to procure can be provided by an M or WBE. Some of that comes from very specialized manufacturers and providers. And then I think, from our perspective, I think one of the other things that we're exploring on our side is, we often we want clinicians and the various user departments within the hospital to consider the use of minority-owned or women-owned businesses on solicitations, but there is a such thing as physician's preference. So we really are doing our best to, in partnership, think about how we can best support the hospital. Technology, it really is coming into play. There's a lot of automation now. So we're really just trying to think strategically about, how do we best support the supply chain management department at the hospital. And then also I'm probably jumping ahead, thinking about how do we partner with the clinical staff and understanding what it is that they need to purchase, why they're purchasing what they need, why do they have preferences over certain products versus others. I know some products just are what they are, right? Like an imaging machine is what it is. Like GE makes that machine. There is no way someone else is making that machine. But we work with the hospital to also explore other ways where we can get participation, where there isn't a brand specific or something that is sold, that is proprietary to like a GE or a pharmaceutical company, but also exploring how, what does lawn care look like if they have, lawn care services, or I shouldn't say lawn care, but landscaping services. Is there a way when, physicians, like, is there a reason, or I should say a way we can work with the physicians to understand like how the equipment and the materials that they use on a daily basis that really impacts the lives of folks like me and you on this call? Because like that's how I'm trying to think about that, like how we work with them interacts and how that impacts the end user. And then of course, being in alignment with cost savings and all of that. So this is kind of how we think about it. So we really support them in the same fashion that we do the CPO here at Cook County government. We just have someone who has a little bit more of a specialty, and we try to really go into the process open-minded, because we know that there is some level of um, I don't want to say difficulty, but it is. I mean, like certain things you're just not going to be able to get participation on. So it makes us wear our creative hats a whole lot more.
Okay, thank you. So, thank you for that, Nicole. And then I guess it's also really important to know, just the same as like with the OCC relationship with Cook County government. We monitor contracts over here. We don't manage contracts. So the user agency, if that's what they're also called, Cook County Health, whoever's putting the contract out are the ones who actually manage the contracts. We over here are monitoring the compliance element of the contract to ensure that once the contract has been awarded to whomever, that it's being followed the way that it's supposed to. So that relationship in and of itself, as you've mentioned before, is no different from anything else. It's just the additions that we're talking about. So keeping what Nicole said in mind, we're going to hold that right there. Charles, I want to shift over to you. So when we think about procurements with Cook County Health, this is a kind of a double question. So number one, how do you all decide on procurements? Number one. And then number two, how would a business go about, or is there an opportunity for businesses that maybe there's not a need for something right now, but you know how it's often said, like you really don't know what you need until somebody presents it to you. So is there an opportunity for people who have really good services or people who have really good products to be able to either pitch it to Cook County Health or put themselves in a position where it's considered for something in the future? So first question, how do you all select your procurements, or how do you go about that? And then the second question, how would a business, if they have something that they feel will be valuable or something that's being used in another maybe health system somewhere else, could be a benefit to Cook County Health, how would they go about putting themselves in that position?
Okay, so handling that, I was at first interested in, I want to say a little bit about the health system and what they were, but I'll just shift straight to the question. We do our procurement based on our Cook County procurement policy, which is derived from the Enable Ordinance for the county 083-0-35, and then the Cook County Procurement Code, Chapter 34, which our policy, the health system policy, is derived out of that. So where we do competitive bids, RFPs, and we have a GPO, as Nicole mentioned earlier, group procurement organization. We are a member of that, which is Vizient, and all hospitals throughout the nation are members of GPOs. And the way the GPOs work is if we have businesses that can give us a good, a service, or a piece of equipment, then we don't have to advertise that to the public. We go to those vendors to get quotations for contracts. And that being said, though, we still run all of that through the Office of Contract Compliance for minority participation. Then outside of that, we administer RFPs a lot for the procurement of our items there as well. Those are posted to the public and advertised in solicitations. And once they are advertised, there may or may not be a site survey with it or a site inspection meeting. We get the proposals back. We have an evaluation committee. After the evaluation committee, we may or may not call the vendors in for a presentation or a demonstration, and then the committee make a recommendation for award, and we carry out the award. We like for most vendors to be registered, with our website, so they know about opportunities and I'll share that information later on in the presentation and stuff, that they can, so they'll be notified when items go out for solicitation. And we are down the line of automation and stuff. We are working within the Bonfire system. Very soon we'll have Bonfire up and running, where vendors can also register in the Bonfire and see solicitations that are advertised, bid on them, get email notifications and things of that nature as well. and I believe that the second part of your question, so it's being that again, we are a government agency and we have strict policies that we have to follow. I try to be very careful a lot with vendors when they want to do cold calls and stuff. So we don't necessarily do cold calls with stuff. Again, we prefer individuals to be certified. However, if you're using department, and I know you guys call them using agencies throughout the county, but here within the health system, our internal customers are using departments. So if you're using department, have something that they need to look into outside of supply chain. They don't have us involved with that process. They will, do a proof of concept of something, with talking to a few vendors or doing a few things or whatever like that for a proof of concept. And then when they're ready to procure, then we step in and become part of the facilitators of taking them through the right process for those particular procurements. So hopefully I answered your second question there.
Yes, thank you. Thank you. So I know you had mentioned that there was something that you wanted to talk about before when I asked you the question. Feel free to talk about whatever you want.
Yeah, so not to bore everybody, but this is I get very passionate about this part because we're on a mission here at the health system, and with that mission, I get very excited about it and have a passion for it. So hopefully I'll bring my voice down and talk with a certain cadence here and be slow enough and articulate when I talk about Cook County Health and what it is, right? So we are one of the largest public health systems in the country, our safety net. Actually, I think right now we're sitting at like number 3 in the country behind New York and LA County. So our health system in providing a wide range of health services for our patient, our health plan members, and the larger community as a whole. Right now, we have about 600,000 unique individuals that we deal with annually. Our FY24 budget is $4.26 billion, which is roughly 46 or 47% of Madam President's $9.148 billion budget for the entire county. Holistically, from a large standpoint, we're coming off of a 4-year pandemic where we did our public health emergency where we dealt with COVID-19, and with that and when I say we at this point, I mean my department and what we did. My department for those whole 4 years were in the office pretty much every day, working on buying all the needs, everything that we needed for utilization of dealing with the pandemic, all the way from the PPEs that we were buying to the equipment to the fact of when we got to the vaccinations, and we vaccinated over 1 million individuals with vaccinations. Then we went from COVID to monkeypox. Thankfully, monkeypox didn't last that long. And now we're dealing with the regular flu. We were still dealing with COVID. We're dealing with the regular flu. And then the RSV, which is a respiratory illness and all that individuals deal with. So that being said, holistically, looking down into the system themselves, we operate John H. Soldier Hospital, which is the number 1 trauma center in the nation and the number 1 burn center in Illinois. We just recently put 2 Da Vinci robots in that are robotics for our surgeons to utilize. Provident Health, we have an outpatient dialysis center there. We just recently opened the ambulance department at Providence, as well as opened the ED department that was closed for many years. Our community health centers throughout Cook County offer primary and specialty care. That's about 14 of them throughout the Chicagoland that we support. Right now, one of the biggest things they're dealing with is the migrant workers, not the migrant workers, but new arrivals and migrants that come in. We administer all the health care there for the county and the city. And we've expanded to the landing zones where they come in at with providing medication there and health care there, transportation for them to and back for for their appointments. We have the Ruth M. Rothstein Core Center, which is a comprehensive care for our patients with HIV and other infectious disease. We support the Cook County Department of Public Health, which is a state and nationally certified health department servicing suburban Cook County. Right now, parts of their programs, and a lot of their money is grant funded that they have. A lot of their programs is dealing with, as we look at social economical issues here, food insecurities, lead abatement, mosquito abatement, housing, substance use disorder for individuals that has to try to get over that and have coaching, so on and so forth. And then opioid overdose prevention and stuff as well. And then finally, with the Department of Public Health, looking to narrow the gap with the life expectancies for individuals in Cook County versus those within Chicago, like from North Shore area to the west side of Chicago, there's like a 10, 12-year age gap between life expectancy gap between those individuals. We support the Cook County Health Correctional Health Services, which is CERMAC, the jail. We provide all the health over there for the jail and the temporary detention center. And then finally, County Care is our largest Medicaid managed care plan in the country. It's over 10 years old now. We have about 465,000 lives or members that participate within that. So in a nutshell, that's the health system as a whole with what we do and what we support here in supply chain management and procurement for the entire system.
Wow, that's a lot.
Yeah, it's a lot. And I wish I had some of the team that Ralphie has in his shop.
Yes, I'm glad you mentioned that though, Charles, because I think that gives everybody kind of context and some idea of like maybe figuring out what I think one of the biggest issues that I find when I'm talking, even having been in this space, but in other spaces working directly with business clients, is them not being able to accurately communicate their scope of work. And so, of course, when we talk about certification, when the certification teams talks to businesses about certifying, that's a question that they have to be able to answer, because if you're not able to identify your scopes of work, then you're not able to identify your codes, and you're not able to really be able to clarify what you can do on a contract. And so I think when you share the different types of user departments, if you will, that CCH supports, it kind of helps, or at least it should help business owners identify how they fit in that, or how they could possibly fit in that. So before we go further, I just want to stop real quick and ask if there are any questions. I know we had some questions come through the chat, and Rafi and Nicole did a great job responding to many of them. A couple of them are for you, Charles, but I'm gonna see if anyone has a question that they'd like to just come up, put your hand up, and then I can call on you to come off of mute. We can do that real quick, or if you just want me to ask your question in the chat, you can drop it in the chat. Let's see. Is it Chatal? Chatal? Okay.
Hello, how are you? And thank you for putting this program together. Very informative. Thank you, Charles. Thank you, Rafi, and everyone else. My question here is that I am trying to, I've met some of you at some of the vendor fairs. I'm looking to connect with personnel, the buyers at the county care, so that we can introduce our services and solutions for their managed care, for Medicaid patients, specifically at-home screening solutions for colon cancer and HbA1c. I'm not having any luck connecting with anyone at the county care. Can someone please help me in that direction, guide me in that direction?
Yes, I can. The Chief Administrative Officer for the County Care Health Plan is a gentleman by the name of Aaron Galena, Galeener. And you can reach out to his office. I think his email address is I believe, aaron.galena@cookcountyhhh.org. Here, let me just find out right quickly for you. I'm sorry. A Galena. We'll put it in the chat for you.
But with that, I think that's great. But can someone help me get connected? Because sometimes, the emails go unanswered, and if they don't know who we are, it just becomes like we send the email and then we don't know if you received it or not.
Being called right now. Apply for the 100 plus women of Westinghouse scholarship.
Oh,
Sorry about that. Got it.
we can.
Sorry, I missed that.
Yeah.
Didn't hear that properly.
Yeah, you can. I'll make sure that Dr. Butler have my contact information so that she can provide it over, and then you can reach out to me, and we can seek to put you in touch with Mr. Galena. However, that I put there is also too with his plan. He goes through my shop for all his procurements and follow the normal code for everything as well. So you can have a conversation about proof of concept or something like that. But it's best for you to register. And when we post RFPs on behalf of County Care that within your space, then you'll be notified.
Absolutely, we'll do that. Thank you.
All right, you're welcome.
Thank you so much.
Thank you. So Daniel had asked, where do we register as a vendor? I think Daniel, that is the bonfire. If you're talking about Cook County government or Cook County Health, they each have their separate bonfire portals. Go ahead, Rafi.
The question is coincidentally very well timed because I was typing a response in the chat to someone, and in my response I am going to put the link to the OCPO's registration page at our homepage. So everyone just look out within the next couple minutes. I'm going to respond with the link to OCPO's registration. A couple of things I just want to highlight about the OCPO's registration in our bonfire system. Number one, when you register, registration with the OCPO is wholly separate and apart from the Office of Contract Compliance's MBE WBE directory. So if you're registering with the OCPO, you are not going to get into the MBE WBE directory. Nicole and her great team run the directory and that certification process, and so my database is wholly separate from the MBE WBE directory. Now, one of the reasons why, or one of the benefits to registering with the OCPO, when we advertise a solicitation in your area or areas of interest, that morning we will send you an auto email informing you that we advertised a bid or an RFP or an RFQ in your area of interest. It's a really convenient way for you to learn about when we advertised an opportunity. You don't have to come to us. We're going directly to you. The other ways you can learn about our opportunities, whenever we advertise and whenever we make available an opportunity at our homepage, at our current contract opportunities link or page, we also publish the ad in the Chicago Tribune. By code, we have to publish an ad in a local paper, and we do so in the Chicago Tribune. You can look in the classified sections all the time to see if we've advertised something that way. But really, the best way to keep to stay on top of when we're advertising something, get into our vendor database with the OCPO. I'm going to put the link into the chat very soon. And lastly, if you want to get a forward look of when we're going to advertise something or the forecast, our buying plan is a great resource to get an idea of when during the fiscal year we're going to advertise something. Well, we identify all the anticipated procurement opportunities, and also for each one when we're looking to advertise it. I did put into the chat already the link to our buying plan page, so it's already there. So, but thank you, Dr. Butler.
Mm-hmm.
And with us, that buying plan that Rafi's talking about, last couple of years, we've been very on time with being a subset of that plan. So the health system opportunities will be in there as well. When we get through with this meeting, I'm going to send to Dr. Butler a PowerPoint presentation that has how to do business with Cook County Health, as well as how to partner with us. Has all the websites, has everything. It takes you through Bonfire, as well as just going to our website and logging on. Within that, you'll have there's 5 or 6 opportunities that are already posted on our website now that's active, and there's about 27 other ones that's coming up soon that you can look out and be on the lookout for.
Okay, and before we finish this out, because we have about 10 minutes, there was another question in here. Lindoria, I believe she asked, does the hospital have a behavioral health component?
Yes, very good question. So that was one of the things that I was going to kind of wrap up with and talk about. But yeah, right now we have hired a chief behavioral health officer by the name of Dr. Thomas Nutter, working with our behavioral health and psych. We are through the fact that we have opera funding, American Recovery and Protection Act, where we've received about $165 million over a 5-year period to spend towards certain endeavors for the health system. That has allowed us to grow our behavioral health program and our mental health program. So that's one of the expansions that we're working on. Sometime soon in the coming months, we will open up a facility out south that was, I apologize for not having an address now, but it was one of the old Howard Brown facilities that will be working with the Department of Capital Planning and Policy and stuff and Bureau of Assets Management. They're helping us to refurbish that building and get it right to set up for our behavioral health expansion.
Perfect. Thank you so much, Charles. So I just have a couple of last points as we start to wrap up. So Charles, this question that I'm going to ask you, it may be completely crazy. I don't know. But I'm going to ask it anyway. And then
I might give you a crazy answer back if it's crazy.
I'll ask you a crazy question. You give me a crazy answer. Does the hospital focus on certain types of procurements over other types? And is there a certain type of industry that would be more successful than others in the hospital space?
Yes. So obviously, as I spoke of earlier with the group procurement organization, the GPO, that's one of our biggest, again, bread and butter, because they have everything as members, every type, not necessarily every type of good, but no, I'm sorry, not necessarily every type of service, but every type of clinical product and every type of equipment that we want to buy comes through the GPO. So, and that's one of the biggest thing there, as Nicole alluded to earlier and stuff. When you're buying a lot of product for healthcare and clinical use, there's requirements with it where stuff has to probably be hermetically sealed and stuff. We buy MRIs, we buy CT scanners, ultrasounds. That doesn't lend itself that much to participation for individuals, and there's not a lot of people in that space. However, what I say when we buy the capital equipment and stuff from those GPO vendors is, upon installation, there are vendors that are certified within the county that can help with the installation of those. So we, again, the GPO, first and foremost, can't help to continue to emphasize the fact that we still take the GPOs through the Office of Contract Compliance for them to see where we can have participation wherever possible. And then outside of that, again, because we try to stay away from those sole source, which is physician preference type items. Is when I was at private healthcare, we call them physician's preference. We try to stay away from those as much as possible. We do RFPs. And then I think your other question was any type of industries that would be more successful than others. Just focusing on our MBE, WBE partners. Typically in our particular space, we see a lot of participation in professional services. My boss is calling me. In professional services, temporary staffing, construction at times when we have smaller construction now, because again, Rafi Shop is back to doing all of the heavy constructions. Installation of equipment, support services such as consulting, financing, architecture, and engineering, nurse registry, and then lastly, call centers. We have a couple of call centers that we do. Call center support is those areas that we see a lot of participation from certified county or city MWBEs.
Perfect. Apparently, it wasn't a crazy question. All right, so Nicole and Rafi, and Rafi hit on this a little bit earlier, so you may have already answered this, but are there any plans to collaborate with CCH in the future? And if so, do you have any idea of what those collaborations might look like as relates to like vendors?
Sure. Thanks for the question. So as I mentioned at the outset, we do the construction procurement for the health and hospital system. And construction also includes any architecture and engineering services for a specific construction project that's the health and hospital system has in mind. So to that end, we currently have right now one request for qualifications advertised for design services for a project at Stroger Hospital. And then we have, we're working on right now 5 other separate requests for qualifications, each for design and design services for the health and hospital system. We anticipate advertising those 5 other RFQs within the next month to 2 months. Hopefully within the next month, but hopefully no more than 2 though. And then as I said, as more construction architecture projects become available from the health and hospital system, we will advertise those as well.
Thank you, Rafi. Okay, so I did want to get to this one question before I overlooked it. My apologies, Debbie. So Debbie asked earlier, when looking into the portal for Bonfire, I see that the time to bid closed in March. My understanding is that it is for 3 years. Is there any chance that there be an opportunity for rebid, or will we need to wait 3 years to submit a bid for business at the CC hospitals and other facilities under the umbrella for medical personnel?
Yeah, so for that particular, it sounds like to me, if I understand the question correctly, we put up a solicitation for medical personnel or particularly temporary staffing. It's closed and this individual missed that opportunity. So yes, unless they are, they're subcontracting with somebody or they're part of a proposal for a subcontractor there, that opportunity has closed and has passed because we're in the evaluation stage of the RFPs, and we will be looking to do an award sometime soon.
Okay. Okay. Sorry about that, Debbie. Connie, hello. Do you have to be signatory to do work with any of these entities?
Signatory.
I'm not familiar with that.
Yeah.
Connie, would you like to come off mute real quick?
Hi. Thank you, everybody, for your time. What I meant by that is you have to be a local union signatory.
Okay. Okay. That's what she's asking.
Yeah, so even though we have labor work within the health system, everything that we do does not involve the unions and collective bargaining agreements.
Okay. Connie, does that answer your question?
Yes, thank you.
Okay. Does Cook County Hospital have a portal for vendor? Okay, so yes. So this brings me to the end of this. So Charles, what's next for CCH? How can vendors connect? I know you already talked about the Bonfire portal. Do you want to drop that in the chat for them?
Yeah, I will send you, I will send you the full,
Okay.
packet that have everything, and I prefer that they get the, the full 7-course meal for this one. So I'll send it to you, and you can send it out to them. What's next to us is that, we hope to continue to be a beacon for the community, for the underserved and the underrepresented, as we continue to treat all those that enter our doors, regardless of their ability to pay. As I said earlier, we are expanding our behavioral health footprint because it is sorely needed within the communities, and especially the African American community and other people of color. We are in the midst of the Democratic National Convention is coming in August, so we're right here in IAM. It's 2 blocks down the street from us, so we're having meetings. We're doing emergency preparedness and all to get prepared for that in case the rioters and the protesters and all, if anything jump off there. And then lastly, but not least, most importantly too, we're always seeking to grow our MBE and WBE participation, whether the MBE can be a prime or a subcontractor for the contracts. We're never satisfied, and especially under my watch, we're never satisfied with our numbers, with where they are, even though they've grown over the years and they're pretty steady. We're always looking to do better in the category. So we'll continue to partner with Ms. Mandeville's office and Mr. Sheridan's shop to do what we can.
Thank you. Okay, and then Asha, I think it's Asha. Asha asked, when can we expect requirements to roll in for IT staffing with CCH?
Good question. I would have to look into that one and check with our CIO with the opportunities that are still there for them. I know they have a lot of their department is outsourced with temporary staffing. I'm just not sure at the moment when that contract is up for an RFP.
Okay, so someone was asking about the buying plan and all that. I'll make sure, Charlie's gonna make sure I get all that, and in my follow-up email, I'll make sure that all of that is included, along with the link to the recording and to the chat. I'll make sure you have a copy of the chat notes in the email as well, so you'll have all of that from me from today. Thank you all so much for being here. Nicole, thank you for everything. Did you have anything you wanted to close out with, Nicole?
No, I mean, actually, no. I would say that I did drop in the chat a couple of times the direct links to register with both CPOs on the government side and the healthcare side. And then I also dropped the links where you can directly register with both offices. I would just encourage folks. I mean, I know there were a lot of questions about specific procurements. I would encourage you, if you're not registered with these two, with the hospital or the government's CPOs, to register there. And don't stop there. I mean, you have access to the buying plans on the healthcare side and the government side. But if you're interested in just exploring contract opportunities with other municipalities, that's how you go about doing it. You need to be registered in their databases to be able to receive the information. The information doesn't magically fall in your lap. And it's a lot of information to get access to. So if you actually hit the Cook County Contracting Opportunities webpage, there are hyperlinks to other other entities that are procuring products and services that are either affiliated or a sister agency to Cook County government. So I just wanted to drop that nugget as well.
Thank you so much. Very much appreciate it. All right, you all. Thank you all so much for being here. I appreciate it. And stay connected to me for the next webinar on whatever we're going to bring you. Right. Have a great rest of the day.
Thank you for having us.
Thank you.
Thank you. Thank you, everyone.
All right. Take care, everyone.